Building downtown. Building downtown. Building downtown. Building downtown.
Thank you so much for having me on again, guys. It'd be great if we could talk about something else other than COVID, though.
Yo, Kirill and I were just having that conversation. We're like, wouldn't it be nice to have him on sometime and not talk about this bullshit?
Let's talk about head injuries and people beating each other up, and violence, and we're still talking about a virus.
No,
I could use a head injury right now.
Exactly. Me too. You know, in London, it's funny you said that. We just had another mini outbreak at University Hospital, and it's just driving me nuts. You know, and I think it's people in the community are going nuts. It's very, very difficult times right now, and people want to see a glimmer of hope. And I'm still very optimistic, but there's a lot of unknowns, and when you have unknowns, that's what frustrates people, because we can't really predict. You know, I couldn't tell you when I'd be able to fly to the States just for a family vacation. I can't tell you what date that would ever be possible. You know, I have friends preparing for the Olympic Games in Japan, and it's weird because they're proceeding as if it's going to go ahead. The Olympic Committee is proceeding as if it's going to go ahead, and in the midst, the world is still dealing with new infections and new variants and new mutations, and it's just the whole world has become schizophrenic.
I've seen some videos of Japan having water pool raves already.
Jesus!
They put it
water pool raves.
Oh yeah.
Oh,
yeah.
That sounds dangerous even without this shit going on.
That's true.
Everyone who's high out of their minds, get in the deep end.
Exactly.
Holy Christ.
Let some fluids out.
Yeah, the Olympics, that's an interesting one too, because borders are shut down, everything. They really don't want people going too far out of certain zones, even down to cities in some places, provinces, whatever. And that's just representatives from all countries, not all, but a ton of countries all over the world. Is that, even though there's going to be a ton of testing, I would assume, is that just a disaster waiting to happen, in your opinion?
I mean, what I just don't know what the fuck is going on. Like, no country is speaking up about the Olympics. Nobody has the balls or the guts to say anything. The athletes, I just worry. I hope they're not being given false hope. They're being told to proceed as if this is going to happen. The Japanese people themselves do not want people coming to the Olympics. They don't want people from all over the world congregating there. Now, mind you, it would just be athletes. And I know that the organizers are taking every precaution possible to make sure that if the Olympic Games are held, it's held in the safest environment possible, no audience, you know, and really the athletes will be properly housed and isolated, I suspect, with testing. But I still think it's, at least at this time, it's highly irresponsible. Would I be comfortable holding the Olympic Games now? No. It's going to be interesting to see what happens by the end of July. You know, right now, we don't even know. We know that the vaccines work in terms of preventing people from getting sicker. So if I'm vaccinated and I get the COVID-19 infection, I would have a less severe manifestation of the illness, or I would be asymptomatic, which is good. But what we don't know is, does the vaccine actually prevent you from carrying the virus and transmitting it to others? So until we have, you know, mass amounts of people, or the vast majority of the population vaccinated, I'm not sure if it will be safe. And I think it's going to be tough to get the world vaccinated by July. And you know, so I want the so-called experts who are, you know, on CNN every day talking about everything. Nobody has said a shit about the Olympics. Like, it just drives me crazy. And yet, and then the International Olympic Committee is saying, you know what, we're going out, we're good to go. Everything's good to go. You know, the Japanese congregation says we're good to go. But and athletes are being told to get ready and show up for qualifying competitions. And, you know, I just, it just baffles me that the world leaders are not speaking up about this. And maybe they feel that in July we'll be good to go. I don't know. But the way things are right now, I'm not sure we'll be good to go.
I mean, they've managed to move the whole UFC to an island, right? Maybe they create a bubble like that too. Maybe that's
in Japan.
yeah.
I mean, it is an island, so there's that.
Right. They might try.
I mean, I think that ship has sailed since the UFC is selling tickets to their Jacksonville show next month. So
That
that's
one was
happening.
interesting to me. I get you got the Apex in Nevada, I think it's in, and then you got Fight Island. I didn't think they'd move out of there. And the Jacksonville one, I'm like, you might be pushing it now, guys.
That's interesting. Amy, do you know what audience number they will accept there? Like, is it only up to open to 2,000 fans, for example, who are socially distanced, or does everyone have to wear a mask? Like, do you know any details about that?
no, I don't know any details. The most, and I'm not fucking around here. The most educated guess I can give you, being very privy to Florida knowledge, is that it wouldn't surprise me if all restrictions are lifted, but before then in the state anyway.
Oh man.
So it's up in the air. I mean, I don't think you're going to have a high percentage of people hoping to have guidelines in place. It's not one of the states that's been particularly positive about that this entire time. So, which is why they continue being able to do events there. If you guys recall, the last events they had in person were all there as well. They had like 3 in a week because it was the only fucking place that would let them come.
Texas was in the news recently too. Like, they're not. I mean, in many parts of the United States, mask wearing is still optional, right? I don't think it's mandatory even when you necessarily go inside a store. It might vary by state, but I thought they were a bit more lax there. Is that correct, Amy?
So in the States, it is optional even when it's mandatory. So no, there are definitely, it is state to state and it varies greatly. So yes, Texas made the news recently, Alabama, Mississippi, because they lifted all restrictions, including masks. So what seems to be more common, rather than a unified set of states doing even somewhat similar things, is the corporate sector. So it's, instead of saying most states have, even similar guidelines, because they don't, it'd be easier to say like Walmart and Target and Publix, like all these big public places and public transit, like they're requiring masks and distancing. So that's, in my opinion, easier to kind of describe than say, I mean, I can sit here and list you all 50 states and give you completely different guidelines for all of them.
Very interesting. I mean, Canada, we've been so good here. Like, the Canadians have been amazing. I still say that, no matter where you go, everyone is listening to the rules. I haven't seen any sort of dissidence at all. But,
down here we have mask burning parties.
I know.
Oh my God.
You know what?
Shit,
Actually,
what a country.
And here's even further on the other end of the spectrum. I was just talking yesterday, actually, to somebody I know who lives in Ireland, has been there her whole life. And she said the restrictions there are still so severe that not only is everything closed, like they can't get haircuts, they can't get their nails done, they can't do any of that, but that they can't even go farther than 5 kilometers from their home, and there's police checkpoints.
Wow.
Can you imagine? I said, if that ever happened here, you would see the mushroom cloud from there. That would never go. That would more. It would never happen, ever.
No, it's true.
Some places in Europe are mandating like you have to have N95 or the FFP2 or whatever was the name, the real masks. You know what I mean? You can't just have a piece of cloth on your face anymore. Mm-hmm. And some places I should suggest in double masking.
Yeah, that's so interesting, because even within our hospital systems here in Ontario, you're not mandated to wear an N95 mask unless you're going to do an aerosolized procedure. Unless you're going to be exposed to aerosolized procedure. So if you're going to be putting a breathing tube in or exposed to someone who's on a ventilator, then you have to wear an N95 mask for sure. And if you're going into a patient who has known COVID-19, there's high risk of COVID-19, you go into the N95 mask for sure as well. But just to see low risk patients who screen negative, it's not even mandated in the hospital. So it's interesting how different countries have different rules. And I think making the community wear N95 masks, which are quite uncomfortable, honestly, is very surprising to me. Interesting.
Yeah, they're pushing for it, and they're pushing for doubles, and it's I'm not gonna say a country name because I don't remember, but I want to say Czech Republic. There's been a viral video of a man getting arrested for not having a double mask.
Holy
Well, I mean,
Wow.
he obviously probably shot some shit back, right? They didn't just tie him up right away. I'm sure he
He was probably
but
drunk, started swinging.
yeah, but
Yeah.
the reason for the conflict was because he didn't have a double mask, and they tied him up, took him
You
away.
know, the thing is, when fear grips you, we sometimes, even as people, as lawmakers, make irrational laws that may not even make sense.
Mhm.
You know, that to me does not make sense, to double mask in the community, and it makes sense to have a mask on and to hand sanitize and to socially distance, and that's, you know, but to take it to that level probably shows you what that country is going through right now with the severity of the infections and the rapidity with which it's spreading.
And
People are making these kinds of decisions.
would
Well, not only that, that also just smacks of we need to do something and feel and sound and look like we're doing something, but we don't really know what to do.
Exactly. 100%. 100%.
would
That's what
doubling
it's-
up in masks even do, like, would it prevent any more? I saw.
So I wear a double
Droplets.
mask. I wear a double mask when I'm in the hospital. Remember, COVID-19 is spread by respiratory droplets, and if the patients are in our hospital, the patients are masked,
Yeah.
and the providers are masked with regular surgical masks, level 2 masks. Level 3 masks, but not N95.
Yeah.
The reason I double mask and why some of us are is if the mask doesn't have a visor, you're required to wear a visor to protect your mucous membranes in your eyes. So the reason I'm double masked is especially when I'm in a high risk ward, is I might have my N95 on or a surgical mask on, but you need to also have a special mask that has a visor on it. Now, our level 3 masks have visors on it, so one mask is good enough. But the N95 mask, which is the ultra protective mask, does not have a visor attached to it. So if you have an N95 mask on, that's actually not good enough in some ways, because you need a visor to protect your eyes. So that's why some people do double mask.
We're gonna
for
be
that
wearing
reason.
helmets soon, man. You know what I mean? Just isolated.
Holy
It's
shit.
crazy.
So the third wave apparently Ontario is getting now. We've talked about this before. You don't know what the fuck to believe that's out there, right? You don't know what to believe. Even things that should be legitimate outlets aren't so legitimate anymore. What is the actual truth to this? Is it a real thing that's happening? Is it a thing that is on the brink of happening? Is it bullshit? What are your thoughts?
You know, it's too early to say, guys. You know, and I honestly, I'm so isolated in London. I'm only looking at London data often,
Yeah.
but I can tell you that
How is
before
London?
the so-called London's doing okay, except, you know, we have this issue at University Hospital. But I mean, up until recently, we were down to less than 10 cases a day, new cases a day.
Wow.
And then over the last couple of days, though, it's gone up to 30 to 40 new cases a day, right? So we are seeing an effect of the opening up our society, and you know, but I'm very hopeful that this will be a blunted effect, and that we're not going to see a massive influx like we did with the second wave of patients who are sick. You know, all of our long-term care residents have been vaccinated, have at least received the first vaccine. All of our healthcare professionals who work in the hospital have been vaccinated. You know, we're getting even most of the medical students done. We've just started vaccinating, as you guys know, here in Ontario. Those who are 80 and older are all getting vaccinated, getting their first shots.
Mm-hmm.
We have now the AstraZeneca vaccine in addition to the Moderna and the Pfizer vaccine that's now available. And the advantage of that one is it can be stored in a regular fridge.
So
it's
are they
just
not pausing the AstraZeneca one?
No, you know, that's a good question, Amy. As you know, in Europe, they stopped it because there was a concern that there was a link to causing blood clots.
Blood clots, I heard.
But remember, blood clots are fairly common out there, and I think from my interpretation of what I'm reading, that it's too weak. The data is too weak right now to make any link between the vaccine causing those blood clots.
Well,
now we'll
they've
have to
said
see.
that. They've already said that with the sample size of people getting the vaccine and the number of clots, it's no higher than the normal occurrence.
General population, yeah, and the higher, yeah, that's correct. So you know, and I see patients who develop blood clots. Just even though I'm a kidney doctor, I see it in my practice all the time because it's fairly common for patients with medical problems to get blood clots in the legs, and then you have to put them on blood thinners.
Mm-hmm.
So right now in Canada, we're still actively giving the AstraZeneca vaccine. And I'm hoping that as this, as the vaccinations start to ramp up more and more, that we will be able to protect our citizens so that even if they do get exposed to COVID-19, that their manifestations are not as severe. And, even in the mini outbreak that just happened at University Hospital, we've actually discharged the vast majority of the new cases, and we've isolated the healthcare providers that have developed the infection. So, I think there's going to be a third wave. It is real, but it's going to be a blunted wave. I really hope I'm correct on this, but that's my sense, and that we're going to be okay. But it also depends how we behave as a society. In London, at Western University, there was recently similar to your rave party, another party out there where there were people who were exposed. Unfortunately, it depends how we behave as well.
Building downtown, building downtown, building downtown, building downtown.